side, what this is doing is we're going to, all these lines that I made is where we're gonna actually make a little incision. We're going to actually detach this, okay? And then we're gonna sew this together again, this edge together again, so it'll lift you. I don't know if I'm explaining myself well. And then this is detached, you know, like we're trying to give you a little earlobe, okay? So it'll detach right here. Okay, you're all now. I'm gonna have you turn a little away from me. Yeah, there you go. The worst part is over.
Oh my.
Oh. You are just great. Okay, you'll be fine. And you let me know if anything ever bothers you, okay? Nothing ever should, all right? Could you do me a favor? Can you pull that bandage off? So I'm gonna cover you just so your ear kind of sticks out and you can see it. And we're gonna talk about this for a moment, okay? She has what we call a pixie ear. The pixie ear is actually created by having a little neck lift or a lower face lift, where when the surgeon does the surgery, they reattach. You can see her scar looks really good right here in front of the ear, but they kind of reattach the ear to the side of the cheek here. So it's like your earlobe is continuous. So it's not not something that people particularly love. So we can fix this actually by just disconnecting it. So you shouldn't feel anything other than my touching you, okay? If you feel anything sharp or anything, make sure you let me know, right? Good, you're doing just great. So she has a little scar tissue here, but despite that, we can try to remove that little area, the connection, you okay? And reconnect it, so she should be able to see right away that it's all fixed. You've been dealing with that for a while, actually. So it's about time you got that fixed. There's that, and then this is where I'm going to reapproximate the earlobe, and I'm going to take less skin because we have to reshape an earlobe. And if we do that, we turn the earlobe under so you lose some of that skin. If I'm explaining myself well enough. So we're going to just take out this little triangle really of tissue. You're doing fantastic, right? Nothing painful, nothing uncomfortable, correct?
Correct.
Good. As it should be. So taking out this triangle of skin here. Left in the past, that was many years ago. That's why it's like a little whitish here, but look, everything looks good. Just kind of loosen the skin up here so we can close this side to side. I hope you don't mind my little running commentary.
Not at all.
Okay, good.
I'm learning.
Can you just dab and then just pull this slightly up maybe? See if we can. There we go. Because now I don't want this to be connected to the ear anymore. I'm going to loosen it and close it side to side down here. Good. Let me actually take a little, you can drop it now, yeah. I'm going to take a little extra tissue here so that, because this is scar tissue here. We're going to put this side to side here. So now, instead of stitching it to her ear, I'm going to stitch it side to side. Lower this a little bit here so I can see. Side to side like this. You're doing fantastic. Just tap. Thank you. See what we're doing there. We're repositioning that, and then make sure a little bit. Looks really good so far. Very good. Just gonna trim a little of this extra tissue here and close this nicely. Because all that's gonna be trimmed side to side here too. So I'm gonna this a little, debulk it. So you're gonna come back in 1 week and we'll take out these stitches.
Okay.
Can you see over there, honey? Make sure this doesn't lift up. It doesn't. Don't think it will. Yeah. It looks good. Almost done on this side. So let's see here. So the one thing is so now I want to turn this earlobe onto itself, and I need to like make it less thick, otherwise it won't turn in as well as you guys can understand that. Does that make sense, you girls? I'm kind of doing what's called debulking. I'm going to try to undermine it a little so it will fold over onto itself here. And make sure it's nice and okay, I think that's good. Okay, let's get that together now. Looks good. So now what we have to do is get it so it's not having a rounded edge right there. I'm going to trim a little bit from that edge. Right here. Let's see, what do I use here for this? I'm going to use my hook here. This is the one issue when you have that edge. You could keep going up, back, keep winding up the ear, trying to kind of get that little curve part. So let's see if that, actually I think that's gonna be good. Let's try that more stitch down underneath, and I think we should be done on this side. Actually, a couple stitches right here still. see how that's gonna sit. I think that's gonna sit nice. It's just swollen right now, so there's a little bit of it that sticks out just a little bit, your earlobe. But we want it to, that's the whole point of doing this in the first place. So it's gonna come down with this. And the swelling comes down. One more stitch right here. Good. It's followed me in here. Just close it right now. Hold on, let me do this one. I want to extend it a little bit more. I think I could get it a little bit straighter here. There's too much on one side versus the other. There we go. Okay, I got it. Okay, let's turn it out a little too much. Sorry, I mumbled to myself. And then people on these videos go, why are you talking so your volume is all low? It's because I'm mumbling. Because I mumble to myself. Sorry.
We all do.
People, they yell at me.
It's called being human.
Maybe it's called being in the 40s. Okay, good. I like it. All right. I'm going to show you in just a minute, too. I think you're going to like it, too. Okay. We're going to move to the other side. So you can stop that for a moment. Now because it's just nummy and puffy. See, it's all puffy here. That's not going to stay like that. But you're going to have a new earlobe there. See? Difference already.
Yeah, I can. This is how I used to look.
Yeah. It's nice.
Oh.
And if anything, we pulled you a little tighter. Yeah, that looks good. I like it. They're nice. How you like them?
I love it.
Oh, you got your ears back. You were waiting for a long time for that to happen, huh?
You are absolutely right.
Yeah.